Well, as Canada prepares for National Non-Smoking Week, our local health unit is encouraging people through a program called Don't Quit Quitting. Joining us now from the Simcoe Muskoka District Health Unit is public health nurse with the Substance Use Prevention and Harm Reduction Program, Adam Armitage. It's great to finally meet you.
Great to meet you too, Sarah. Thank you very much for having me.
Our pleasure. Let's talk with the dangers behind smoking.
Yes, so smoking we still know is the leading cause of preventable disease and premature death in Canada. Here in Simcoe Muskoka, unfortunately, it is attributed to 1 in 6 deaths, and hospitalizations 1 in 10 is attributed to smoking.
Do we have any idea of how many people are still smoking, still embracing cigarettes?
Yes, in Simcoe Muskoka, it's approximately 1 in every 10 people still. But the good news is that we have beaten the threshold of former smokers to current smokers. So now there are more former smokers in Simcoe Muskoka than current.
Okay. Vaping, we just saw some video of it right there. It seems to become to be more and more popular these days. Are there dangers around that? And would there ever be an instance where you might refer vaping as an alternative?
So first, as a health unit, we would recommend that someone try the Health Canada approved products if they're trying to quit smoking. So the patch, the gum, the lozenges, things like that. For the people who have trouble with that and are not able to quit, vaping can be an alternative of harm reduction for them.
Okay. Something that we don't often talk about is how smoking affects the people around us. What would you say to that?
It certainly can. So when someone has their cigarette lit or is breathing it into the room, that's the secondhand smoke that comes out. And it's the same particles and chemicals that they're breathing in that can affect those around us. And when we're out and about in public spaces, we would like to have those smoke-free because there are children and other people present, and so that can prevent them from seeing it as normal and wanting to smoke in the future. It also protects those from the chemicals themselves of the cigarettes, as well as those who are trying to quit or stop smoking. It helps them not being triggered out in the public.
You mentioned something called third-hand smoke. What is that?
So third-hand smoke is what eventually arrives on the surfaces after the second-hand smoke comes up and back down onto tables, clothes, whatever. But yeah, so it could be touched, and all those chemicals that were in the air, in the person's lungs, it doesn't matter, it lands on the products in your home, and unfortunately babies, pets, other individuals can touch it, and it can cause some harm.
Let's talk about the program, Don't Quit Quitting.
It works through a website, so don'tquitquitting.ca, and it's an Ontario-wide resource for individuals, adults who would like to quit smoking or vaping. It has a lot of good resources all in one place. People can learn where they can have chat support, telephone support, online support for counseling and coaches to help them get through the withdrawals and to learn about nicotine replacement therapy and where they can get that for free. It has a great quit calculator, so those who are interested to learn how much they could save from quitting smoking, they can do that there, as well as a lot of good tips and places to learn how to evaluate someone's relationship with smoking and how and where they're going to need to do different things, like deep breathing, distract themselves, and how to build a plan so the next time they try and quit, they can be successful.
Okay, we'll leave it there for today. I've been speaking with Adam Armitage from the Simcoe Muskoka District Health Unit. Let's go ahead and pull up the website because there are some resources on there. You can also rewatch this interview, ctvnews.ca/Barrie.